Our project is about breast cancer and the types of treatment that people use and their success rates. In this presentation, we will touch on the prevalence and importance of the study, some background information on breast cancer, signs and stages, as well as the treatment types and survival rates. Breast cancer is the presence of malignant cells in the tissue of the breast. The causes of breast cancer ranges from family history, genetic mutations, and lifestyle factors being the greatest cause. These include things such as drinking alcohol, being overweight, or not performing physical activity. Signs of breast cancer include lumping or thickening of the breast or near the underarm, fluid from the nipple, skin changes or shape changes, or dimples in the breast known as peau d'orange. Tests to examine the breasts include a physical exam, a clinical breast exam, and a mammogram. A physical exam includes a check for overall health, feeling for lumps, and looking at past illnesses. Clinical breast exams is when the doctor checks for lumps. The target areas for the CBE are the breast and underneath the armpit. And lastly, the mammogram is an x-ray of the breast. Women are encouraged to get mammograms 1 to 2 times a year once they are 40. Stages of breast cancer vary from stage 0 to stage 4. Stage 0 is when the cells are just abnormal and are not yet invasive cancer. Stage 4 is the least curable, which is when the cancer is spread to other organs in the body. Current treatment types vary between the woman and the stage of her cancer.
Treatment types can vary between the traditional treatments and/or complementary and alternative treatments. The traditional treatments are radiation therapy, chemotherapy, hormone therapy, targeted therapy, or surgery, which can be breast-conserving surgery, a total mastectomy, or a modified radical mastectomy. Most common treatment is surgery, where they remove the tumor and the nearby areas that have been affected. Even though surgery is most common, sometimes in the later stages, chemotherapy may be used to first shrink the size of the tumor that will be removed.
So if you've been diagnosed with breast cancer, how do you know what treatment options are available and which is right for you? I've come to speak to Charles Coombs to find out more. Charles, how do you decide what type of treatment somebody needs?
Well, we do this based on the size of the breast cancer, also what we call the receptor status. So we do various tests on the breast tissue which tell us to some extent what sort of treatment to give people.
So once you have all of the information gathered and everything you need, what sort of treatments can you offer?
First of all, in terms of surgery, a lot depends on the size of the breast cancer and its location in the breast, so as to whether the surgeon decides that just simply removing the lump itself is adequate rather than the mastectomy. Once that has been done, what we call the medical treatment, in other words, the drug treatment, consists of anti-hormonal treatment, then there is chemotherapy, and then there's other therapies such as antibodies or receptor-directed therapy.
Of all of those treatments, surgery is probably the one that we hear about the most. So can you explain in detail what this means?
Well, surgery can take two forms. It can either take the form of what we call a wide excision, which simply means removing the lump. If the lump is larger or in a specific area of the breast, like the center of the breast, they may need to do a mastectomy.
And that's taking the whole breast?
That's taking the whole breast, again, together with some of the lymph nodes.
I know some people have had radiotherapy. What is it and what does this involve?
This is anti-cancer ray treatment.
And does this happen instead of surgery? Or?
No, normally it happens following surgery, and the aim is to kill any cancer cells that might be left after the operation.
And can you tell me about chemotherapy?
Chemotherapy is a form of treatment. Normally it's given every 3 weeks by injection, which is normally given over an hour and a half to 2 hours. The side effects are mainly sickness and can cause hair loss, but now with techniques such as scalp cooling and these very strong and good anti-sickness pills, sickness and hair loss don't happen in many patients.
And what about hormone treatments?
It's to block the hormones or to stop them being made because it's estrogen that comes from the ovaries and other tissues in a woman's body that can drive the breast cancer cells to divide.
And Charles, of course, very rarely men can also get breast cancer. Is the treatment offered exactly the same?
The treatment's very similar. Breast cancer in men is very rare. It's very important for men, though, to go to the doctor early if they notice any abnormality.
So it seems there are plenty of ways to treat breast cancer, but if you're concerned or need advice, then always speak to your GP or consultant. If you want any more information about living with breast cancer or breast cancer in general, then why not visit the Cancer Research UK website or take a look at the other videos in this series.
Complementary and alternative medicine is most often used with traditional treatment, but sometimes can replace it. Examples of this type of treatment vary from meditation and massage to hyperthermia and cryotherapy. Hyperthermia is when the breast tissue is exposed to extremely high temperatures in order to kill the cancer cells. Cryotherapy is the opposite. It uses extremely low temperatures to destroy the cancer cells. CAM treatment can be used to alleviate side effects, improve health, or create a more pleasant treatment.
When Emma Jean Wilson found a lump in her breast, doctors said the prognosis was bleak.
You had a very rare cancer.
Very rare, 1 in 3 million, and only 1% is in your breast.
It was angiosarcoma. So rather than rely on chemotherapy and radiation alone, Emma Jean decided to turn up the heat on her treatment, literally.
The blue is the temperature.
She enrolled in a clinical trial at the Duke University Medical Center, one of thousands of volunteers who, along with doctors, are hoping that something as simple as heat can improve standard cancer treatment.
They said, well, what we'll do is we'll fix a table and your breast will lay in a bath of water and we'll sort of microwave your breast. And I said, what?
Microwave your breast?
Mm-hmm.
Yeah.
But that really is what it is.
Duke is one of a handful of research institutions pioneering this new field called hyperthermia. While scientists have known for centuries that heat has healing powers, Duke's Mark Dewhurst has figured out how to harness that heat and direct it right into tumors.
The temperatures that we're looking for are in the range between 104 and 113 degrees Fahrenheit. In that range, we get the effects we want, but we don't burn the tissue.
Is it uncomfortable? Is it, is it getting hotter and hotter?
It will.
Dewhurst and his colleagues know that the heat weakens tumors in two crucial ways. It damages tumor cells, and it makes the tumors more vulnerable to radiation and chemotherapy.
We can deliver 30 times more drug to a tumor with it like this than you can with just the free drug itself.
The Duke team is experimenting with heat on some of the most stubborn cancers: breast, melanoma, cervical, ovarian, designing and developing intricate heating systems as they go.
And in the next several months, using this brand new equipment, Duke researchers will be experimenting with heat on entire bodies for people whose cancer has spread.
Once this study is over, the next step will be to get heat therapy FDA approved and on the market. That will probably take a few years, but the goal, says Mark Dewhurst, is to one day soon have heat actually being prescribed, just like a drug.
You think we can cure people this way?
I would hope that we could have dramatic anti-tumor effects. Whether or not we can cure them is hard to know.
For now, Emma Jean isn't worried about a cure. She's content to sit back and think warm, well, really warm thoughts. Elizabeth Caledon, CBS News, Durham, North Carolina.
Survival rates for the different types of treatment for breast cancer vary. After researching many articles, the information is inconclusive on whether or not CAM treatment truly does increase these rates of survival and the quality of life among breast cancer patients. Although that was inconclusive, almost every article that was researched shows an increase in the prevalence of CAM treatments among patients in addition to their traditional treatment. To analyze survival rates, doctors look at the 5-year observed survival rate, which refers to the percentage of patients who live at least 5 years after being diagnosed with cancer. In order to get a 5-year survival rate, doctors have to look at people who were treated at least 5 years ago. Both improvements in treatment and the addition of complementary treatments in the last 5 years may result in a more favorable outlook for people now being diagnosed with breast cancer and could also potentially lead to an increase in the 5-year survival rate.